Hi Hana, I'm Akila. I'll be your trainer for the next few sessions. So for today we'll be talking about pre-participation screening. So I'll be seeking for your consent for these 4 things: pre-participation, cardio fitness, balance assessment, and exercise prescription. Okay, pre-participation screening is basically asking about your health condition through the health questionnaire, and no worry, I will help you through it. Okay, the purpose of pre-participation is to check if you need any medical clearance, which level of exercise intensity for you. There are 3: light, moderate, and vigorous, and check if you have a health condition that require any supervision, and I should take notes of. So once you are cleared for this, we can continue on the cardio fitness and balance assessment. Okay, so from the information and data I get from your pre-participation, cardio assessment and balance assessment, I'll be able to create a 8 weeks plan exercise for you to achieve your goals, and how does it help. Okay, so before we start, I'll be asking for your informed consent again, informing you the exercise procedure and demonstrate to you how to perform it. Okay, there will be a time where I might require to spot you. For example, when you do balance assessment, I might stand beside you to catch you in case if you lost balance. This is to prevent you from getting injured. Okay, as a client, you must inform me how are you feeling. Ask me if you have any question and or concern, and you have the right to not to perform the exercise and withdraw from participation. Okay, so you can sign here as to acknowledge that you understand what is the pre-participation. Okay, now we will be moving on to the steps for pre-participation screening. There are 5 steps. The first step is complete the form. There are 2 PARQ and exercise pre-participation health screening questionnaire. Second step will be asking for your disease history. Third step will be asking for your sign or symptoms of the disease. Fourth step is asking your intended exercise intensity, and the fifth step is where I'll be checked against the SESM pre-participation screening algorithm. So let's go into the details. So for the step 1, you'll be doing the exercise pre-participation health screening questionnaire because you are someone who exercise regularly, right? So step 1, asking for your symptom. Do you experience any of this? Chest discomfort, unreasonable breathlessness, dizziness? Okay. So step 2, has you performed structured physical activity for at least 30 minutes at moderate intensity on at least 3 days per week for the past 3 months? Okay. So step 3 is the last step. If asking about your medical condition, do you have any of this? Heart attack, heart surgery, heart failure, and others? Okay, so once you done, you are clear for step 2, which is asking for your specific disease. Do you have any cardiovascular, metabolic, or renal disease? Okay, so step 3 is asking for your sign and symptoms. Do you experience any of this? Pain or discomfort, shortness of breath, or unusual fatigue? Okay, so step 4 will be asking your exercise intensity. Do you desire for light, moderate, or vigorous intensity?
Moderate to vigorous.
Okay, so step 5, using the SESM pre-participation screening algorithm, there are 2. First is for those who does not participate in regular exercise, and second is for those who exercise regularly. Okay, so you'll be using this one. And since you mentioned that you don't have any cardiovascular, metabolic, or renal disease and no sign or symptoms, it means that you don't need any medical clearance, and also you can continue with your current exercise volume or intensity or progress as appropriate. Okay, so the purpose of SESM screening algorithm is to determine if you are fit to exercise, what level of exercise volume intensity is suitable, and if you require any medical clearance. So some additional information for you to do before the assessment is to wear sports attire, have a good rest and hydrate yourself before the assessment. Don't consume food, alcohol, medication, caffeine, or tobacco 3 hours before the assessment, as it might affect your performance and results later on. Okay, that will be all for today. Thank you so much.
Thank you.